Okay, we are now recording, and I believe that I'm going to have to share screen if you want some slides. Carol, I
The transcription.
Very good. You know, Carrie, I sent those slides out to the people that whose names I had for the DD committee yesterday, so they may have them. I think I can just discuss the data. I don't think it's worth going through a lot of trouble to show the charts. We can put them in the minutes or something.
Okay.
Okay. All right. It's good to see everybody, and thank you very much for the opportunity to speak. I came today because I want to ask that the committee give some time and attention to the planning process for long-term day and employment capacity. 2 years ago, the committee requested and the county board affirmed the need for short-term and long-term planning to increase day and employment capacity in the county. And I know a lot of you remember this. The short-term need is being addressed by the new employment training program, which I'm guessing is going to come online pretty soon. As of a year ago, the long-term need was supposed to be part of the county's capital improvement program process. It was also known as the CIP. And the CIP is renewed every 2 years. In other words, it's on a different cycle than the regular annual county budget. This year is the off year. So my expectation is, or was, that next year's CIP will include a proposal to address the long-term capacity need component. This really is a one-time opportunity. I don't know that the county board has ever really extended this opportunity before. It's likely to require a significant investment on the part of the county. And to my knowledge, there hasn't been any discussion of it in the committee for at least a year. So I'm speaking because I want to just get a few questions on the table for you all to consider for the future. And the first question is whether the new facility will provide only day or habilitation programs, or will it support a hybrid of day and employment options, which is the recommendation of the public consulting group. I think you all remember the consultant that was hired by the county in 2021. Many of you participated in PCG's focus groups, and flexibility between day and employment opportunities was one of the priorities that was expressed by the stakeholders. So that's really the first question. The second question is whether only one facility or whether multiple smaller facilities are being considered. And there are a lot of practical issues here, but I think PCG came down on the side of smaller programs just because it's easier to provide community inclusion with smaller programs. The third question I'm going to talk about this more in a minute, but is what methods is the county using to project a target capacity that is going to meet future needs? I think that's a pretty tricky process. And again, it's just something that, we haven't talked about, or you haven't talked about. And the fourth is what factors are being considered in identifying a location for the new program? Is it going to be near transportation? Is it, what else is going to be there, and what goes into that determination? So I also want to express, and this is what's in the charts if you had a chance to look at them, a concern, which is that day program enrollment has not come back from pre-pandemic levels even yet, even though all of the programs are reopened. And I'm in talking about this, I'm referring to data that was published with the county budget in February. So just to give you an idea, if we go back 5 years, we have to go back. Okay, there you go. If we go back to FY 2019, which is 5 years ago, which is how far you have to go to get a pre-pandemic baseline, there were 222 active adult clients, and 160 of them were in day or habilitation programs. projection in this county budget document for 5 years later in FY24 is that 283 clients, active adults, with only 140 in day programs. So the overall clientele has gone up pretty significantly, but the day program enrollment is dropped and it's still lower than the pre-pandemic level. Another way to look at this is percentages. I kind of see this flashing up on the screen, but it's, I'll just tell you what these numbers are. Pre-pandemic, 72% of adult clients received day program services in fiscal year 2019, but the projection for fiscal year 2024, at least the one in the budget document, is that only 49% of adult clients will be receiving day program services in FY 2024. So this really is the question that I have. If you were going to bring FY24 up to those FY19 percentages, you would need another 63 additional day program spaces. And that's just to serve the increased growth in the past 5 years. The new capacity is also supposed to be building in future growth, and it's supposed to be providing some options for clients who are currently not served in Arlington. I think there's a lot going on in this data, and I don't claim to understand what all of the factors are. It very well may be that some of the decline in the day program enrollment is being offset by increased employment, but I'm not sure that that would explain all of it. So I'm feeling that more data and analysis of the trends in adult client engagement, if we think about engagement as being day program, employment training, and actual employment, I think that's something that's pretty critical to determining an appropriate level of the planned future capacity. And one thing I think you should be especially cautious about in looking at this is that if you are projecting this long-term need, I think what this data is telling us is that you cannot make an assumption that the current capacity is adequate and that all that's needed is some small incremental amounts for future growth. I think it's very possible that we're working from a deficit and that we need to overcome or address the deficit before going on to look at future growth. So this is really what I came to say. I'm not expecting a long conversation about this now. Sherry and I had talked about this in advance. I know your agenda is full. Most of you know how to reach me if you have comments or questions. I'd be happy to have a conversation about this and supply anything that I have on the history of this issue or the data that I'm using. So thank you very much. I appreciate your time.
Thank you, Carol. And as incoming chair, I've appreciated your help in understanding numbers. Today, we're going to discuss some of the historic programmatic indicators that we've had both with the county funded and waiver funded clients. And there may be some information in response to your questions during that discussion. And then the other great thing is that she's not surprising people. So Carol has shared this information with LaVoice, and LaVoice indicated that whatever questions aren't addressed during the presentation, she can add to the minutes at a later date, especially to the minutes themselves, especially since we're now meeting every other month instead of monthly. There's an opportunity for clarifying questions of Carol, but not for further comment or discussion. So are there any clarifying questions that anyone has for Carol? Okay, thank you, Carol. Next we have another request for discussion around the state rental assistance program. So Donna, you said that you were going to have some folks speaking on SRAP today. Is that
Yes, I
correct?
just want to make sure, right before I handed them the camera and the mic, I wanted to make sure that was the entree for one of our self-advocates. We just have a quick comment. One of our self-advocates, he'll introduce himself and explain the situation, but I think a pretty compelling story for why we need to have more opportunities like this to our young adults in Arlington. So no further ado, I'm sorry, this is a little unusual, but Paul has been going to stay here for the whole meeting. So Paul, if you'll just tell the committee a little bit about who you are and what brought you to your current living situation.
Well, my name is Paul Osgood, and I'm 42 years old. Just had a birthday actually recently, which is awesome.
Happy birthday.
And what brought me here is the fact that I was living in Falls Church originally, and it wasn't as inclusive. I was stuck in my building all the time. I didn't have nothing to do. And my parents found out about Miss Dawn and the stomping grounds and stuff. And once they found out about it, and I found out about it, and Gillian Place also, I said, I mean, why not? So I moved out here, and ever since then, it's changed my life because I have made way more friends than I probably had like in a lifetime, and also done like a lot of really cool things like the dinner clubs and movie nights and things like that. So it's really changed me as a person.
So Paul, if you don't mind me asking, can you know how old your parents are? Can you share how old your parents are approximately? Don't we know birthdays are private, but are they?
Approximately they're in their like 70s, 80s.
Okay, perfect. So they were trying to figure out a long-term sustainable solution for
Exactly.
you. And one of the things that made you able to move here was because there was a housing choice voucher.
Yes.
Not SRAP, but that opportunity that made that sustainable for your family. Is there planning? All right. That, I think, anything else you want to tell? Just that this has been a great opportunity.
It has been a great opportunity, and I enjoy it.
Right, perfect. Thank you for sharing your story. Personal story. Why we would maybe want more of these opportunities.
Thank you. We always appreciate hearing from folks who are receiving services, and we really appreciate that. Are there any clarifying questions of Paul? I'm bringing up later on in the day, but are there any clarifying questions of Paul? Great. Is there anyone else who wishes to provide public comment? Okay, thank you very much, Carol and Paul. And so at that, we're going to move on to the next item of business, which is approval of the minutes. Have folks had a chance to look at the minutes that were sent in the mailing list that I sent things to and also sent by Robert Petros last week? Are there any corrections or additions? Or comments? I like the new format. So thank you, Tom. Is there anyone able to make a motion to accept the minutes?
I so move.
Thank you, Lynn. Is there a second?
Yeah, I'll second.
Thank you. So any other conversation? Then the minutes are accepted. Thank you very much. Next on the agenda, Jeannie, are you ready? I mean, sorry, too many people. Lisa, are you ready to present the legislative update?
Yeah, I'd be happy to do that. So here's what's going on, starting with General Assembly. As folks may recall, they were expected to complete the budget in February, but that did not.
Lucy, can you hold for just 1 second? We're going to turn the volume up.
Oh, sure.
Can you test the volume, Lucy?
I
for
sure
us?
can. Are you able to hear me better?
Can you hear?
Yeah,
It's at
a little better.
Should I go ahead or do you want to do more adjustments?
Better, much
Oh, we're good.
Okay. Then the General Assembly did not finish their budget as expected, and now we've been told pretty clearly that it's going to be late June before that happens. That's a pretty big deal for a number of reasons. The budget goes into effect July 1. So all of the language things we had in the budget, for example, combining the caps on assistive technology and electronic home-based services, looking at core services as an alternative to the waiver waiting list, trying to remove some barriers to work and having that cost you your waiver services, all those kinds of things are on hold and probably won't have time to be implemented in terms of regulations because of how delayed the budget is, in addition to the actual spending parts of the budget. And the state has now said they are waiting to hear news on the federal budget before they finalize their negotiations, and that's being held up by conversations around the debt ceiling. So this is it's not that unusual in recent years for Virginia's budget to get delayed. For it to be based upon federal debt ceiling negotiations is unusual. So it's hard to know when exactly we'll have more news, but hopefully in about a month or maybe a month and a couple of weeks, we'll have more to share. And I'm happy to get that out to folks as quickly as possible, but we're still sort of in the budget purgatory, if you will. There's some other big things going on in the waiver world, one of which is Virginia has to renew our waivers, even if they don't change anything. Every 5 years, they have to put in an application to renew them as they are. And when they put in that application, they continue to allow parents to be paid caregivers to minor children, which was a flexibility allowed during the pandemic, which was great. So that would be to kids under 18. But they said for parents to do that, the parent would have to be employed by a home health agency, as opposed to using the consumer directed model. Yeah, that is the right reaction, which is what is very widely used. In fact, I'm going to see if I can put it in a chat. There was an absolutely wonderful article that Virginia Mercury put out about this today. So they put that in the application. We are fighting that tooth and nail. We are going to keep fighting it. But if nothing were to change, that would go into effect in November of this year. So no matter what happens between now and November, you'll be hearing from us as we fight on this and as if we need to give families information on how to navigate these waters. So it's very frustrating and we are with you 100%. So again, with that said, any remaining public health emergency flexibilities end in November unless they're being continued outside of the public health emergency. For example, the state's chosen to continue them and put in a separate application to do that. The last thing I'll add on the Medicaid front is that Medicaid hasn't really been doing renewals as scheduled during the public health emergency. The idea was they didn't want to risk kicking someone off Medicaid during a time of a pandemic, which makes sense. Now, all of those Medicaid renewal applications, which apply to anybody who has just Medicaid health insurance and anybody with waiver, are happening. So my biggest concern is making sure that folks are in touch with their waiver eligibility person to make sure they've got the right contact information. Did someone move during the pandemic, right? We just need to be really responsive to those requests for paperwork without risking someone's Medicaid being lost. So just kind of spread the word. Make sure you should be hearing from your Medicaid eligibility worker. There's likely not a reason to be concerned about someone's actual eligibility being maintained, but if they don't get that reach out from the eligibility worker and respond to it in a timely fashion, then they will lose Medicaid coverage, and that's the big deal. The last big broad news I'll share is that until January of next year, there is a one-time ever adjustment so that military retirees can go back in and adjust their survivor benefit plan. So that means the people who get money when that military member passes away. And that's a big deal because prior to the creation of ABLE accounts, parents often opted out of those retiree benefit plans, fearing that it would cost their child Medicaid and waiver eligibility. And then once they retired, they couldn't go back in to adjust it. So this is a one-time ever chance. If someone retired from the military and opted out of those benefits for their child, trying to protect eligibility for other programs, they can go back and and adjust it. And I know this is an area where we have so many military and ex-military members, and I would love for folks to know about that. I would hate for them to miss this window. The final thing I'll add is just about what's going on with the Arc of Northern Virginia. We have a 4-part webinar series coming up from Gary Schulman, who was a lifelong kind of disability speaker and educator in New York. And he's doing a series on how to be a parent advocate, how to deal with hurtful words and things that you say. His workshops are virtual because folks didn't seem to want to come in person, but really well liked. Lots of comments, kind of, he manages interaction really well on Zoom, a lot of kind of a support group plus resource sharing plus empowerment. And so those are on our website. We've got a webinar coming up on workplace readiness skills, speaking to what Carol was just talking about. It's a timely topic. We are now starting to host monthly free sessions where for 45 minutes, a parent can come in and chat with a special education attorney to get ideas and advice. We have a brand new webinar coming up called 100 Ways to Use Supported Decision Making, where we will literally go through 100 different iterations of how you can make this work, and all kinds of ongoing resources about tech for independent living and travel training. So that's all that I had for today. Thank you so much, Sherry.
Say, will you send those notes to me with links so folks can register or find out more about the military benefits, as well as more about the proposed, the Medicaid waiver application to the state, and whether or not there's any work that we can do to make sure that parents, family caregivers can continue to care for their kids without having to go through a home care agency? That's wild. Okay.
Yeah, it is wild. I am happy to send all of that.
Great. Okay. Thank you very much always for the updates. We depend on them. Next on the agenda is the Developmental Services Annual Program Review. Jennifer, you're presenting, and Lauren, you're presenting also, correct? First, and
Start the conversation.
what's that?
I think the voice is going to start.
Oh, okay, thank you.
The voice.
LaVoice, go ahead and can you introduce us?
I can. Tom, are you ever able to share the PowerPoint that I sent to you? If not, I can share my screen.
I did not receive anything.
Okay, I pulled it up. I sent it to you earlier, but I didn't just. I'll share my screen.
And my laptop is down, so I can't get it from here.
It's okay.
No problem. I can go ahead and share my screen. Give me just 1 second to navigate that. Okay, let me know when you're able to see me.
Yes. We can see it.
And thank you for your flexibility. Let me actually mute my computer.
The voice has to use one device or the other.
Okay.
Okay, can you guys still hear me?
We can hear you twice.
You may have to turn off the speaker too.
Yeah.
You have to turn off one device.
Okay, let me try turning off my phone. Okay, can you hear me now?
Yes.
Not very good
That's
now.
perfect.
Okay. Thank you. So, and thank you, Jennifer and Lauren, who are also presenting today and were the intended, I was primarily going to present, and due to my being out of town, I asked Jennifer and Lauren to step in. But I'm just got back in town today. So I'm going to go ahead and present, and with their assistance on several of the slides. And they're both there in person.
The voice, we can't see the slides any longer. Could you share your screen again?
Oh, sure.
Thank you.
Let me know when you're able to see the slides.
Yes.
See it now?
Yep.
Okay. Excellent. Here we go. So we actually haven't done this in some time. So it was so we're actually excited to be able to tell you what we've been doing in 23 to date.
Voice. There we go. Okay. I think she muted herself too again, though.
Okay, now can you hear me?
Yes.
Okay, I did accidentally mute myself again. Okay. So developmental services, as of January 1st, is part of the now Clinical and Developmental Services Bureau, which houses both the developmental services and the senior adult mental health program. And that's effective January 1st. Highlighting here that our overall fiscal program budget is $9,490,000, and a breakdown of that can be found in the larger Excel spreadsheet that Sherry previously shared with the minutes. And I can also include that when we send out the annual budget for the program. Okay, the programs within developmental services that we are going to discuss today include an overview of support coordination, employment habilitation, residential services, transportation, self-directed services, family support, and behavioral health specific to developmental services. And for some reason, I see whenever I'm advancing the slides, it's automatically muting me. So I'll try to remember to unmute myself each time. I do want to start the presentation as we'd like to do in developmental services with putting what we do in the context of our larger DHS mission, vision, and values. And so just to recap, the DHS vision of a just and equitable community that is healthy, safe, and economically secure and free of systemic racism. Our mission is in solidarity with Black, Indigenous, and people of color, create equitable access to resources and opportunities needed for every community member to be healthy, safe, and economically secure. And our values are racial equity, access, inclusion, authenticity, and accountability. And in our day-to-day practice, we really and truly are driven by the overall DHS mission, vision, and values. And particularly, we aim to embed the values in everything from how we plan for services, how we supervise staff, and just really everything that we do in services, and being inclusive of the people that we serve and making sure that they are at the table, represented and actually participating, and that their voices are also heard. So the first program, Lauren is going to talk about support coordination. So I'm going to turn the next few slides over to her.
So I'm hoping the slides advance with me here a little bit. Okay, good. So the support coordination mission is to maximize chosen outcomes for individuals with developmental disabilities through support coordination and implementation of services in the least restrictive and most integrated community settings.
Dana, I see you on screen. Can you hear? Can you folks hear?
I can hear just fine.
Okay.
Good.
Thanks.
Thank you for checking that. Our next slide, LaBoys.
Did it advance?
Now it did, okay. So support coordination services, we specifically serve individuals ages 3 years and older with a documented developmental disability diagnosis. This includes ID, intellectual disability, per the Code of Virginia. So the next slide, please.
Oh, it should be coming up. I advanced it.
Thank you. Got it. So Support Coordination, the FTE, just in case everybody is aware, it stands for full-time employees. So we have a total of 18.5 full-time employees. What that is actually is 16.5 support coordinators. Of those support coordinators, we have 3 support coordinators dedicated to youth ages 3 to 22. We have 1 dedicated to assessment and evaluation, who also holds a smaller than average caseload. And we have 0.5 dedicated to assessment and evaluation, the ICF support coordination, and the behavior supports committee. The last 2 are the 2 full-time program managers.
Lauren, are you a program manager?
I am.
Okay, so that's our 2 presenters today. So it does not include LaVoice
No.
and Tom and
No, and those FTEs are specific to support coordination. So it's not for employment and residential and other services. It's specifically for support coordination. Next slide, Lauren.
Yep, developmental services is now supported by the senior adult mental health public health nurse, who has been actually a blessing for us, very instrumental in staff training. And I'm going to get into that when we talk about program highlights, just some of the specific trainings he's been able to do for us this fiscal year, providing consultations to support coordinators, and being able to assist with hospital discharge planning, which is very helpful. Active support coordination.
Yep.
And
Laura, I'll talk briefly about this slide if you can, do the next couple after that. So I wanted to just, in introducing active support coordination, because when we get into some of the data about active support coordination, we wanted to just remind you all what active support coordination is, what monitored case management is, and the difference between the two as well. And so, again, we've talked about this a lot, but again, just to recap, this is the core service that is provided to individuals with a developmental disability and also receiving services under the DD Medicaid waiver, also referred to as targeted case management. In Arlington County, we also provide active support coordination for individuals receiving local funded services. And again, we'll go into a lot more detail about this later as well. We consider classified into that local funded services, behavioral health, also our self-directed services and permanent supportive services, basically anything that we're providing that is not tied to the waiver, that is in some way tied to local funded dollars. So thanks, Lauren. You can take the next couple.
Sure. So just a little bit more detail about active support coordination. All individuals who are receiving active support coordination are supported by an annual person-centered plan. This is also referred to as an individual support plan. They're used interchangeably throughout the year. Enhanced case management is a subset of active support coordination. This is for individuals who are determined to benefit from more intensive supports. Individuals receiving active support coordination are required to be visited by the support coordinator no less than once every 90 days. And individuals who are receiving ECM, which is the enhanced case management, are required to be seen at least once every 30 days, so every calendar month, with a visit in the primary residential setting has to occur at least once every other month. Individuals, going into monitored case management, individuals open to developmental services that meet the criteria for DD Medicaid waiver waitlist, but are not receiving a local funded service are categorized as monitored. The support coordinator's role is to monitor changes in an individual's physical, mental, and/or behavioral health that may impact the priority on the wait list. And in Arlington, each individual on the waiver wait list is assigned a support coordinator.
And I will add that we are somewhat unique in that respect because in many jurisdictions, particularly here in Northern Virginia, individuals on the wait list are not assigned a support coordinator. So getting into some of the data, I did pull some data just for sake of comparison for FY22 as we look at the data for FY 2023. Ending in FY22, we had 277 individuals that were receiving active support coordination. And from monitored, we had 275 at the end of the fiscal year. Of that number, we had 201. I'm getting actually some feedback on my end. I'm not sure if someone is perhaps not muted that can mute. That would be very helpful. So of that count, 201 individuals had a waiver and 76 were local funded for services. Fast forward into FY23, and we're primarily referring to data up through the end of the third quarter, March 31st. So as of March 31st, we were serving 288 individuals in active support coordination, so a slight increase over last year. We have, however, seen a pretty significant increase in the number of individuals that are open for monitored service. And these are primarily younger, school age, but some adults as well, just not needing services right away. But that is a pretty steep increase. And those for waiver, a total of 202. As some of you may know, the General Assembly, or may recall, the General Assembly did not approve new waivers for the FY23 fiscal year. So you may wonder, well, why do we have one more waiver than we did over last year? And that's because of the building independence waiver, which is not, it's allocated a little bit differently than the family individual supports and the building independence. Excuse me, the family individual support and the community living waiver. And so almost at any time, an individual that is seeking to live in an independent setting, independent living, can apply for a building independence waiver, which is actually far easier to get than the FIS and the CL waiver. And so we added one individual recently for a building independence waiver here in Arlington County. And so that's why that number is up. We did, however, have several waivers that turned over. It didn't change the baseline of number of waivers, but when someone passed away, we were able to reassign that waiver within our CSB. And so there were some individuals new to waiver in the fiscal year when that happened. And we had a total of 86 individuals whose services were local funded. And I didn't say at the beginning, but we'll have ample time, I do believe, at the end for questions. So feel free to, write your questions down, put them in the chat, and we'll aim to get through as many questions as we can today. So I also did a breakdown for the individuals that are receiving local funding. And this is some people are duplicated in some of these categories. So for example, someone could be in residential services and also receiving mental health therapy, but I wanted to give you an idea of the breakdown of those individuals that are classified as receiving local funded services. And so 30 of them are for BHD, not BHD, behavioral health, receiving developmental disability mental health therapy, 64 for medication management, with the psychiatrists, and we'll talk a little bit more about that later on in the presentation. We have 23 individuals that are receiving permanent supportive housing. And so one of the requirements here in Arlington is individuals that are open to permanent supportive housing receive active support coordination. And the same for those that are open for behavioral health, that's the only service that someone is receiving, the therapy or medication management, they're required to be open to behavioral health, to support coordination. And then we have 15 individuals for residential services that are local funded. And we have a combined total of 30 individuals for employment and day support that are local funded. So some program highlights, I will turn over to Lauren to talk about support coordination program highlights.
So the person-centered plan was updated officially starting May 2nd. There were additions added to the Part 2 essential information around supportive decision-making, annual screening health checks based on an individual's age, and location of medication side effects.
Yep, can't hear you. We can't hear you in the room. You're muted.
Okay, no, that's okay. How much did you guys miss? Do you want me to start with the health again?
I missed most of that. That was kind of
Program
scary.
highlights. Started
Yeah, if you
program
can start from the
highlights.
beginning, I think we missed most of that, Lauren.
From the beginning. Okay. Sorry, there was a lot talking there. Sorry. So our person-centered plan was updated May 2nd forward to include changes to the Part 2, which is the under essential information. There was changes under supportive decision-making, under legal representation, also changes under the health section regarding medication side effects, being clearer on where to find those for individuals, and also health screenings that are completed annually that might not have been documented previously, including hearing, eye tests, annual PAP exams, I believe they're called, mammograms, and colorectal cancer screenings. We also completed health-related trainings, the support coordination team from DDHDS, Office of Integrated Health. We had somebody come in and discuss mobile rehabilitation and the My Passport option. These are services and supports that individuals can access if somebody has a wheelchair and there is something that is broken or needs to be supported. There is an ability to contact DDHDS for their mobile rehab to be able to come to the individual's home, come to their day program, or wherever is easiest for them to receive that support. This could also include other assistive tech like a shower chair or other things that an individual is using in their home to remain safe. The My Passport was something that DDHDS, I believe, is starting to share more details about this, but the My Passport was set up to help individuals who are discharging from hospital settings or rehabilitation centers as a tool for parents to be able to, parents, guardians, support coordinators to use in order to make sure that all of the necessary pieces are checked off for that individual so they can have a safe transition back to their home environment. And we also, again, thanks to our senior adult mental health public health nurse, had a recent training about diabetes. And also he is going to be presenting on hypertension. We added this to the highlight in about a week, so added that anyways. We also had the DD Awareness Month art show. I believe that was quite a big success. We had a lot of different opportunities at individuals. I think actually most of the individuals that actually submitted their artwork did attend the art show as well, and it was just a really beautiful presentation. We hosted the LEAP program, which is Leadership for Empowerment and Abuse Prevention. They came to Arlington County in August to provide training to up to 12 individuals. LEAP is sponsored by the VCU Partnership for People with Disabilities. And we also continue to do our social skills group that is facilitated by support coordinator Bertha Blamo and myself. And I'm hoping that come June, July, when we start this up again, it'll be in person with a hybrid option in case somebody would like to participate still online. So we're definitely looking forward to a return for in-person services with that.
And Lauren, this is about the fifth year that you and Bertha have been doing the social skills group?
I think, yeah, this is about the 5th or 6th year actually, and we have run it at least about 1.5 times per year. So it takes about 3.5 to 4 months to complete the program. And we've had some return participants, which is fantastic. We use them as coaches and supporting newer participants. And we've had, in the last 2 years, just a surprising number of new individuals being referred, which is fantastic. We've seen some good data from that, individuals being able to use the skills they've learned in their everyday life. So very excited about that.
Excellent, thank you. Okay. Moving
Always looking for new participants, so just adding that.
Okay, I'm going to move into
The LEAP
rehabilitation.
was funded by individuals with disabilities?
Correct, yes.
Okay, we're going to shift into habilitation and supported employment. And I'm actually looking at my clock, 5 minutes to 5. We still have 6 programs to get through. But support coordination was by far our largest to report out on. So this consists of our day support and supported employment, with supported employment, again, being broken down into individual supported employment and group supported employment. As a quick just reminder, day support services, these are structured programs of various activities and trainings for individuals that we support, emphasizing here that they are non-residential community-based settings where they occur. And you may recall during parts of the pandemic, there was a great amount of advocacy to try to get day support services to be provided in residential settings. And eventually the department, DBHDS and DMAS did a to say for about 3 to 4 months during the pandemic, we actually provided local funding for some of our day support, our residential services providers, if you may recall, to provide day support services in residential settings. And so we were able to get, I know, at least 2, if not 3, settings across 2 of our different providers for residential services to provide some day support during the pandemic and in our group home setting specifically. The day supports provide an opportunity for skill development, peer interaction, and community integration. And then lastly here, I just listed some of the services, some of the things that services are designed to enhance, such as self-care and hygiene, toileting, task learning, community resource, behavioral skills. The emphasis is really on skill development and relationship building with day support services as well. Supported employment, individual supported employment, looks at tailoring services to the individual specific needs. And so these are often individuals working one-on-one, in employment settings that are of interest to them based on their abilities, and that emphasize career development opportunities as well. The services under individual supported employment can include intakes, helping individuals to look for and identify jobs, so some job exploration and discovery, job preparation, marketing, job coaching, and other just supports to help the individual maintain their employment once they are in an employment setting. Group supported employment offers supervised employment for groups of no more than 8 workers with disabilities in the same setting. In Arlington, certainly for our employment, group supported employment, we look to do smaller groups that average around 3 to 4, as opposed to going up to 8 individuals. So we're looking to support people in group supported employment in much smaller groups. The outcome ultimately is sustained employment that leads to further career development for individuals participating in group supported employment. We would love to be able to have to see them and to support them moving into individual supported employment as a stepping stone up to competitive integrated employment. Examples of group supported employment can include enclaves, some individuals working in mobile crews, and other business models employing small groups of people with disabilities, with an emphasis on working in integrated employment settings in the community. And by integrating, working alongside people without disabilities that are doing the same work. Habilitation and employment is supported by 2 FTEs. Our employment habilitation transportation contracts analyst, most recently that was Elizabeth Cannon. I am very excited that we have someone that we're onboarding later this month, and I'll be excited to tell you about that person next month. We also welcomed a new community and workforce development specialist. This is a new position. Some of you had the opportunity of meeting Delbria Walton in our March meeting, I do believe. This is a position that was really developed out of the work of the public consulting group recommendations. And so really helping us to put a lot of those recommendations into action. And so she's really hit the ground running and doing some very exciting things. So looking at some of the data. So as of March 31st, we had 127 individuals open to day support. And I'll come back to that number in just a second. Of that 127, 17 are local funded, and 14 of them are funded under ICFs, the intermediate care facilities, which is not local dollars. We have 21 individuals that are open to group-supported employment. 8 of those individuals are local funded. And then we have 11 individuals that are open to supported employment, 5 of which are local funded. And then we have 27 individuals that are working in competitive integrated employment with and without support. And that number is inclusive of the 11 that are in individual supported employment. But we then have 16 individuals that are able and successfully working in competitive integrated employment without supports. So for a total of about 47 individuals that are in some type of employment that we support here in the county. So that's very exciting. Some highlights for habilitation and employment. The employment readiness program, which we talked a little bit about earlier, and we've been talking about that for the past several months in terms of a short-term, more interim, but permanent opportunity to increase the number of people that we are supporting in day support. So the employment readiness program is licensed as a day program, but it has a vocational focus in getting people ready for employment. We're also excited that we are continuously meeting the state's metrics for number of people seeking employment that are actually employed, which is of those individuals as part of the annual planning that express an interest in wanting to work are actually employed. And that employment metrics is at 50%. And we've consistently been meeting that and are probably about 1 of 2 or 3 CSBs in the entire state that are consistently meeting that. So we're pretty proud of that. We've had a group supported employment, which is under Service Source at Fort Myer and most of the year Goodwill as well. We are no longer doing the contract with Goodwill. So currently it's Fort Myer is the only setting there, but hopefully we'll be expanding that further. And I have some pictures here of the sensory room. So we put a sensory room at the CIC. It's a beautiful space. It's sort of back in the corner of one of the rear multi-purpose room for the individuals that have actually been there. The picture on the top is kind of this, not textile. You can sort of run your hand across it and make different kinds of designs. We have a rocker in there. We have some other cool things with lighting and other textile, more handheld textile things as well in there. It has a capacity to accommodate up to 3 to 4 people at a time. And so that actually just opened in the last couple of months. So we're very excited to have added that as well.
Voice, can you please explain what a CIC is?
Oh, I'm sorry, that's the Woodmont Center, the Community Integration Center. So some of you probably have heard of it as the Woodmont Center. It's one of the county's 2 day support programs. It's the larger of our 2 day support programs. Not to be confused with the other CIC.
That's what I was going, what? Okay.
Yes, thank you. Okay, I'm going to turn it over to Jennifer to talk about residential programs, residential services.
Hello. So residential programs enable adults with developmental disabilities to live with family or independently, or as independently as possible, in their own home or apartment or in a group home setting. Residential services that I'm going to talk about tonight include in-home supports, supervised apartments, group homes, and respite. We learned about monitored support coordination earlier. I do have a data point for intermediate care facilities, ICFs. Arlington's DD services provide monitored case management for our ICF folks living in Arlington. However, they're neither waiver nor locally funded. They're 100% DVAS funded. But I still consider them residential services, so you'll see it on the slide. And there's one MCE, and that's me.
And one tidbit about that too, just, because I like to just point unique things out. Arlington, Fairfax, and the city of Alexandria are the only localities in the Commonwealth that actually provide any monitored case management or supports for individuals residing in intermediate care facilities. So for all other jurisdictions, it's 100% under the Department of Health. But in our region, actually, and then for the entire state, those 3 CSBs actually provide monitored case management. So which is just an extra additional layer of service and support for those individuals.
Facilities are we supporting people in that?
We have 3 ICFs in Arlington.
Me too.
We have 3 6-bed ICFs.
So you've got 18 beds. Are they full all the time?
There's currently no vacancies.
Excuse me?
There's currently no vacancies. There were some vacancies, I'm getting off topic. There were some vacancies over COVID, and along with other residential vacancies, it was really hard to fill residential vacancies during a pandemic. So what those houses ended up doing was downsizing their license, which we fully support, because there was 2 7-bed homes, and just through over time they weren't able to fill the spots. So it was the perfect storm to lower the license amount. So I'm going to be talking about in-home supports. Those are residential services that take place in the individual's home, family home, or community settings that supplement the primary care provided by the individual, family, or unpaid caregiver. So in-home supports are not a guaranteed first level service provided by a provider. That's always going to fall on the family. Next is supervised apartments, and that provides up to 24/7 supported living in one's own residence licensed by a provider. So that's what that looks like in practice is your clustered apartment model, where you have several apartments in a complex and staff is rotating from apartment to apartment as individuals have support needs. And next is going to be group homes, and those are congregate services provided 24 hours in a community-based home.
And how many do we have in Arlington?
16.
Wow.
Yeah. And then respite. That is our bed that we have in Springfield, Virginia, with a contract with Heartwood, and that's 24/7 out-of-home care and support in a licensed congregate setting, currently at Heartwood in Springfield. We contract 1 bed. It's a 6-bed group home. Fairfax contracts 5 beds, and Arlington contracts 1 bed for emergency and respite purposes. In-home services, we have 31 individuals being served. 6 of those are local funded, and I'll add that to the slide before these go out. For supervised apartments, we have 19 individuals being served, with 5 of those receiving local funding. For group homes, we have 62 individuals being served. 4 of those are locally funded. And there's where you see the ICF DD statistic, and there's individuals in ICFs, and that brings the grand total of individuals receiving some type of residential service to 130. So Under the DOJ settlement agreement, there's an increased focus on supporting individuals in independent integrated housing, which is now a part of an annual conversation facilitated by our support coordinators. So some of the supports for integrated housing that we have here in Arlington include our permanent supportive housing program. We have Arlington housing grants that we've been very lucky, the only jurisdiction in Virginia to provide a local housing subsidy. We now have state rental assistance program that came to us last October. We have flex funds, which is used to help offset expenses from moving from a family home to one's own apartment. And then for those coming from a group home or a training center, there's a service in the waiver called the waiver transition funds. And we would use those funds for those individuals transitioning. Some of our 2023 program highlights. You may have heard that we are redeveloping a county-owned group home at 1212 South Irving Street. So that is coming along quite nicely. They are still putting on the finishing touches, but it's beautiful, and we will have an open house when that is ready. We did a refresh of the county-owned group home at South 3rd Street. We added a new service to the CRI contract, which is independent living supports. It's comparable to when LaVoice was talking about the building independence waiver and how easy it is to get a building independence waiver. If someone doesn't qualify for waiver, they don't quite need the structure of an in-home support service. This sort of fits in between. Independent living supports is more fluid. So instead of a prescribed Tuesday, Thursday, Friday from 4 o'clock to 8 o'clock, well, where some people may not want that much service, and the vendor, you have to be there for them to get paid. So independent living supports is more fluid, so they are able to provide supports to people who have fewer support needs more frequently whenever they want them, and more on demand than prescribed by a schedule. For our SRAP slots, we had 10 slots. We have eight leased, one very close to being leased, and another one in process work. We have one individual who transitioned from a group home to an apartment this year. And
was that with SRAP or with?
Yes, with SRAP. Yeah. And we have 2 individuals who transitioned from institutional settings. One went home to the family, and the other one went to a group home. Thank you.
And I'll correct that the SRAP data when we send this out as well. My apology for that.
No, that was my fault. I checked with the support coordinators today.
Okay, the next program we'll move into, we'll get through the next 4 pretty quickly. Developmental services are transportation supports. Transportation which supports individuals whose day support is locally funded to travel to and from their programs. This year we have 6 routes. This is actually down from 13 routes in prior fiscal years. And those 6 routes support transportation to Arlington, Weaves, etc., to the Woodmont Center, to Alexandria, and that's to the St. Coletta program, to Melwood here in Arlington, and then to various providers out in Fairfax County, including MVLE and 2 service source locations across Lorton and Springfield. And I think one might be in Alexandria, Fairfax County. And that's with those 6 routes, the diamond routes. So I do want to give an update because as you know, we have been transitioning individuals from from Diamond to Motive Care across the mostly this fiscal year, but starting last fiscal year as programs were reopening in the early part of the fiscal year. To date, across that time, we have transitioned 65 individuals with a DD Medicaid waiver from Diamond, mostly to Motive Care. And we will transition the final 3 individuals by June 30th. In July of 2022, we started in managing the transition, we started logging and tracking issues related to the transition. And that provided an opportunity for support coordinators to share information with each other, for them to figure out, when they have similar issues, what works in trying to get things resolved in terms of who to call, and just different things about the process, so that support coordinators weren't reinventing the wheel from person to person. So really an opportunity to share information. So to date, what we have recorded is a total of 75 issues that were logged between July 1st, 2022 and March 31st, 2023. And this represents issues reported for 14 different individuals. And of those issues, we have 3 that are unresolved as of today, but that we continue to work on resolving those issues. Most of the issues have been centered around no-shows, late pickups, and late drop-offs. With an average time, and I put the emphasis on average, to resolve issues has ranged from 3 to 4 weeks. Are there outliers? Yes, where sometimes it could take less than that, sometimes it could take more than that in resolving issues. But on average, with some back and forth, is 3 to 4 weeks in getting those resolved. Moving into self-directed services, as you recall.
Transportation, Lois, I have a question about, you said that most have been transitioned to motive care, but what have the others transitioned to?
So some have the parents transport, some individuals are transported directly by their parents. Some have switched to Metro Access. But the majority have been motive care, but there have been a handful in those categories. Metro Access and parents transporting are another caregiver. And in some instances, a group home may transport.
Okay, thank you.
So self-directed services, you may recall, we started this in Arlington County in 2021. It provides assistance to families through us providing direct funding to the family, and with some technical assistance from support coordination, to be able to purchase support services for the family member with the developmental disabilities. This puts more control into the hands of families on deciding what that individual is going to do in terms of community-based activity. The family really guides the meaningful day activity for that person and what they believe is beneficial to the individual. The individual with a developmental disability must be open to developmental services and not receiving other local funded or DD Medicaid services. And again, this was adopted by our CSB back in August of 2020. We didn't really do much because we launched it and then the pandemic happened. So 2020, 2021, we didn't, I think, serve anyone under self-directed services. So numbers to date, looking at FY23 in Q1, we had 4 individuals that were open for self-directed services, and the same in Q2 of this year. And in Q3, we are serving 3 individuals. One of the individuals that had been receiving self-directed services relocated out of the county. In our transition planning with our FY23 graduate students aging out of the school year this year, we've identified 4 individuals that are interested in actively in exploring being supported using self-directed services upon aging out of IDEA in June. There also, some of them are exploring other things simultaneously the same day to self-directed services. So I don't know that 4 will actually move into self-directed services, but I'm hoping that a couple of them actually will. So we're continuing to grow self-directed services here in the county, and that's pretty exciting that this is starting to, actually being used, and just to see the benefit of it. Family support. We don't talk about
backing up to self-directed services, what are some reasons that people choose not to use self-directed? Because it sounds good.
It
but
sounds good. Well, a lot of people that we support are receiving, they're not, it's, I would say it's an eligibility. They have a waiver, they have other local funded services. So the majority of people we support fall into those categories. Um, and so someone would have to give up, local funded services to use self-directed services or waiver services. Um, but for people that, aren't in a waiver, don't have a waiver, are having, the parents may feel that a traditional day support, program is not necessarily the best fit for that individual. This is an option. So I don't know that it's something that people are offered and they just don't want to do it. It's usually an eligibility issue. Because I'm sure we'd have people that are waiver that would love to do self-directed services, but we don't, duplicate the funding in that way. It's really intended to be for people that, are not eligible for the services otherwise. I don't know if that's answering your question or not, Sherry.
that's good. Thank you.
So family support, this is a local pool of funds that to provide financial assistance for eligible families. And by eligible, those are families that meet the income requirements, some income requirements for Arlington County, but families who incur extraordinary disability-related expenses. These funds serve families who care for family members with the DD diagnoses in the family home. So the person has to be living in the home, not in a group home, living home with the family, and to be able to support and offset costs related to disability-related expenses. The reimbursement is intended to be partial, with families contributing a portion of the cost depending on their resources. And so at a minimum, we're typically looking for a minimum of $5, $10, $15, something that offsets the funding. Examples of allowable expenses include respite, therapeutic instruction, medical, dental, some specialized equipment. And for specialized equipment, such as sometimes we've, done, let's say an iPad that has some type of assistive devices for communication on there, it needs to be with the recommendation of a qualified health professional, a PT, OT, or someone in the same for assistive technology as well, and minor home or vehicle modifications. Those latter three areas need to come with recommendations from a health professional. For this current year, the budget for family support is $28,000, which is what I think it's been since I've been in my role. The total amount used to date is dismal, $837.50. This has actually been underutilized in recent years. And I rack my brain as to why. But in part, I think due to increased resources available under the DD Medicaid waiver that we didn't previously. And assistive technology, but also resources available through MCOs. So when we do get requests, or even before we get requests, we want to still be good fiscal stewards of county resources. So just because the money is there doesn't mean we jump to that first when there's a state pot of money that can be used for some of the same resources. So people aren't going without the needs. We just have more and some additional resources available to families that we didn't have some years ago, but it is still a good source of funds to have. There's also been a lower utilization with the PI program specifically, and I'm not sure what that's about because in previous years, as I looked at some of the data, they've been one of the primary programs actually using family support, and that's also down significantly as well. Recently, though, I started working on a family support one-pager so that as we're going out and doing presentations and talking to, people in the community, that we're educating them about this pool of funds. It is required to have a developmental disability, but the way that the funds were actually approved years ago by the board, it is not required that the individual be open to developmental services, just that they have a documented developmental disability.
So this
Then-
fund is also good for folks on the waiting list who are waiting for Medicaid funded services too.
Yep.
Because Medicaid funds assistive technology, for instance, but the person who's on the waiting list may want or need some other support.
Absolutely.
Good to know.
Yes, but someone, so long as they are living at home, yes.
Okay.
And they could have a waiver or not have a waiver as well. Unlike the state's individual family support, I think it's just for people that are on the wait list. I'm certain it's just for people that are on the wait list. So the last program is our DD mental health services for DD. We have 1.0 FTE, a full-time mental health therapist, and she provides therapy for individuals with a developmental disability and a DSM diagnosis. She also provides psychoeducation for individuals with the developmental disabilities that do not have a documented DSM diagnosis. We have a part-time psychiatrist who provides medication management for individuals that are open to developmental services for support coordination. Oops, and I thought I had the data. I put it on the other slide. So currently, the mental health therapist has 30 individuals, and with a gradually, actually very quickly building. So we're doing some management around that because we've gotten an increased number of referrals. And so we're trying to balance that out as well to accommodate. But she also has a number of people that she's able to close for services as well. So as we're closing more individuals, we're absorbing newer referrals as well. As we ideally to start keeping a wait list for that position. So we've been fortunate that we have not been, had to do that. And then we have for the part-time psychiatrist, currently has 64 individuals from DD that he is supporting with medication management. Before I get to questions and answers, I did want to go back to the employment and the day support specifically, if you don't mind. Let me see if I can find that slide. This slide here, I did want to point out in FY, I guess 20, the year that the pandemic hit, as of March 15th of that year of 2020, we had 141 individuals that were open to developmental services. And we currently, around the same time, 3 years later, we have 127, which does represent a decline in the number of individuals that are open. But I wanted to give just some comments about that as well. One of the other things that we've seen since the pandemic, we have had an unprecedented number of individuals that have relocated or moved out of the county. And I would say probably in my first probably 5 years, we very seldom had people move away. Already this year alone, we have had 11 individuals that have transferred from Arlington CSB to other CSBs, and partly because, a family may live somewhere else in the state and they want their son or daughter to be closer to them. Our families are getting older and people, they're retiring and they move away and the individual goes with them. So when we start looking at numbers shifting, particularly projections, because our projections very seldom, if ever, took into consideration people moving out of the county, and certainly with the volume that we have seen in the past 3 years. So we'll have to figure out in terms of how to get some data for that. The part of the problem in getting some of the data is in a timely manner for this presentation is that we were between different electronic health records. And so some of the data is in our previous EHR that we don't have the same ready access to of getting data. And then the other thing that we've also seen in looking at those numbers is people that passed away, as well. during that time in the last 3 years. So, and that's been pretty significant as well. But a big shift of that, though, is just this unprecedented number of people that have moved outside of the county. And I think that when we start talking about projections and numbers, that we do need to take that into consideration. So now with that, we have 30 minutes.
Yeah,
Sherry, I will turn
then
it
I'll
over
start
to you.
with one question that you began to answer, which is, Carol's, what methods do you use then to target capacity that will meet future needs? How do you look at the ins and outs and the kids coming up from school to decide we're going to need like 30 more slots in day programs or 10 slots, or we're good? Thank you very much.
So we look at our projected growth starting with Arlington Public Schools. And so, I mean, and so we know, recently we've looked at 5 years out. In fact, we shared that information, I think sometime last year with Donna for a grant that she was applying for. And so we can anticipate, what we're going to need in terms of students aging out. What is also helpful is starting to plan sooner than than the year that students are aging out of services. And so hopefully we'll shift in that, because that'll give us better information and better data on trying to understand who's going into day support, who wants to go into employment. Because just because we have 23 students, for example, that might be aging out in FY25, that doesn't necessarily mean that those 23 students are going to go into day support. Because we're also seeing increased numbers of people that are expressing interest in going into employment and not necessarily day support. And so balancing that out. But if we're starting to do the transition planning sooner, we can predict at least 2 fiscal years ahead in terms of what some of our needs are going to actually be with them as well. We also know, because of cold calling, phone calls that we were doing, certainly before Elizabeth started. We'll get back into doing some of those calls once we filled her position, is trying to gauge those individuals that are outside of the county, attending day programs. What is their interest in returning to the county? So we know from a survey that we did back in 2019 or 2020 that there was definitely some interest in people attending programs outside of the program. Surprisingly, a majority of those were leaning towards keeping those individuals in those programs just because of the continuity. They've been established in those programs, doing well, and not necessarily wanting them to move just to come back to a program in Arlington. So we kind of factor those in as well, into the growth.
So are there any, have you been asked to provide assumptions about, for input into the CIP program, such as we would like 2 facilities to house 15 people each, in one in North County, one in South? I mean, like, have any numbers been requested, and what is the process for planning for a future CIP?
I'm going to, I'm looking for Jim.
Oh, Jim.
On to talk, because Jim can better speak to the CIP process than I provide data to Jim based on the CIP process. So I will let Jim speak to the process of that first. And then if there's a question following him, I can certainly follow through on that. Jim?
Sure. So, and excuse my voice, I have a little bit of a toothache. So the CIP process it does go every 2 years for a full plan, but we will be engaging in all the conversations and all of the data gathering in the next couple of months in preparing for the FY25 implementation and requests, right? So the timeline starts much sooner than right up to where FY25 is, if that makes sense. So throughout the summer, we'll start to look at getting some additional numbers together and getting some additional information together and formulating our request to get something into the CIP plan. There's also just a number of factors that fall into this. It's not just about money, it's finding the right space, working with the voice to make sure that the space meets the needs. It's, gathering feedback on many different levels. So there's a number of variables and factors that will go into this.
Okay, and for those of you who are on the DD committee, one of the motions in play for the full CSB is an ability to be part of the development of the, I guess, the requirements for request for proposal. So, I'd like to consider Virtual Joe to bring up citizen participation in the planning for facilities also. Is there any measure?
Well, that I would also like to remind the committee too, because we're definitely committed to getting that input from the committee. It was very helpful, and when we looked to develop the RFP for Irving Street, if you may recall, there was a work group that gave some specific suggestions into that RFP, and we were able to incorporate the majority of that. I think all but 3 things did we incorporate into the RFP, and the things that we did not, we looked at incorporating just into our contracting in general for residential services. We are looking, the closer we get into starting this longer term project, if you may recall, of developing a stakeholder advisory group which would have input into the process. So giving us input in terms of location, how program requirements, expectations, and that would include an opportunity to give input into the scope of work, which is a part of the RFP process. So looking for input from individuals we support, families, the DD committee, and other stakeholders into that process.
Okay, I'm sure that we have folks that are willing to be a part of that process on the
I know we had identified some under Carol's leadership as the chair. There were 3 people that were identified for that stakeholder group. So I can remind you later of who those 3 individuals are.
Okay. So that stakeholder group is a group that's I knew that there was an employment stakeholder group. I didn't know that there was another stakeholder group for the CIP.
It's for expansion of day support and employment services combined. So it's looking at both day support and employment.
Okay. Okay, great. And so that means that you're also looking in future CIP for hybrid employment day type situations as recommended in the PCG report.
Right, and we're actually already starting, that as well. We have a few people, and certainly look to have this increase with all of our existing contract providers for people to be able to, make the choice of doing day support and employment, and not having to choose between one or the other. So whether that's with the CIC, I think we have 1 or 2 people currently, even at 2 people at Arlington, Weeds, et cetera, that are there part-time, and certainly looking to shift that now. I don't know that we need to wait, necessarily for expansion of anything, that if someone is interested in employment currently and day support, and if we're able to accommodate that and our providers are able to accommodate that, that certainly is a best practice, and one that I don't think that we need to wait on to happen.
Thank you. Thank you everyone for putting together this presentation. I learned a lot, and I hope other folks on the committee learned a lot. We have time for one question, and then we have quite a bit of stuff we have to cover for the rest of the meeting. Are there any other questions? Barbara?
LaVoice, months ago, when we were talking about development of new group homes, new living situations, I thought it was mentioned that you were trying to get a respite bed within Arlington County. I mean, we have one respite bed and it's down in Springfield. I thought that there was some discussion or mention of having a respite bed in the new Irving Street house. But I've never heard another word about it. And it's, I don't, is in fact there?
There is.
Yeah,
There
I'm
is
going to let Jennifer take that question.
Yeah. Yes,
Okay.
the respite bed, when I did my presentation, I said currently in Springfield. Spoiler alert, it's going to be back in Arlington when the
Right.
new group home opens.
Okay,
So there'll only still be one respite.
but there's still
Yes.
only one respite
Okay.
bed.
And Irving Street is 6 beds total.
Irving Street is a single residency apartment on the basement level, and then a 5-bedroom group home on the 2nd and 3rd levels. So
And one of those 5.
one of those 5 will be
the respite.
will be for respite.
Yeah.
Okay.
Thank you.
And at the, I'm gonna, or somebody else can correct me if I'm wrong, but yesterday at the executive committee, I believe that they anticipate Irving Street to be ready for occupancy on July 1st. Oh, no, I'm sorry, fall, that the new employment
Fall.
will be also, the new employment day, the day program for employment would be open by July 1st.
Well,
Yeah,
well,
the
the
voice will be able to answer the
construction,
best, I think, right now.
so the
Yeah.
construction for the Employment Readiness Center on the
Okay.
4th floor, we're anticipating that completion to be at the end of June.
Okay,
So if you think about, getting the provider and the staffing, making it operational, I think it's safe to say fall as well.
okay.
So, but, maybe things will happen sooner, but just thinking about all the processes that have to take place once the construction is completed end of June for the 4th floor Employment Readiness Center.
Okay. And Irving Street will be operational when?
We're looking at fall as well. So
Early fall.
that's because of the certificate of occupancy and
Fall starts September 21st.
and all
So
that.
hopefully late summer.
Yes.
Yeah.
But we don't want to call it late summer.
Are the RFPs closed for both?
I think that there are several conversations going on, so I'm sorry for the recording. So to answer your question, Sherry, the RFPs for both have closed.
Okay.
They're, it's still underway in terms of who's the awardee going to be, but at least we have that
Terrific.
wrapped up.
Thank you so much.
I know there are a lot of moving parts.
Okay. The next on the agenda, and this part will be relatively brief for the chair's report. And this is going to be his chair's report and / new business. As the DD chair, this is quite a handful and we need more help. So I have asked Bertram again if she will co-chair this committee with me. And also checked with what our chair of the CSB, Wendy Crawford, who's also on this call, at this meeting. And I would like to nominate Bertram again as co-chair of the Developmental Disabilities Committee. Do I have a second?
You do.
I have a third. And then
Fourth, I'm a fourth, I'm a fourth.
And we're open for discussion. Wendy, do you want to just, since you've come, and would you like to add a comment about the co-chair, chair, anything?
Sure. I was going to wait until everybody said all in favor.
This is the discussion part.
Oh, the discussion
We're
part.
still
Okay.
deciding.
I would say, first of all, very excited that you're looking at this, Sherry, and especially excited that you're inviting Bertram to join you. Just for background for the rest of the group, all of the other committees have the co-chair model because this chair position, it does involve a lot of work, and Sherry does an amazing job, as did Carol, but to have a partner to share that with makes all the difference. So I'm glad to see that your committee's looking at this, and I'm especially glad that you're looking at Bertram for this work. So Thanks, Sherry.
Who's data-driven and bottom line oriented, and yeah, we love you, Bertra, and I don't know if you would like to say anything about any of this?
Sherry, I think that this is important work, and as Wendy said, it's a lot, and there's so many interests, both mutual and non, but I think, the important thing to me is just respecting everyone's time and making sure that we're decisive. And so I hope I can support you in that way.
We can do this together. Is there any other discussion on this motion? If not, I would like to hear from everyone whether or not you support this nomination of Bertra as co-chair. Anyone? Opposed? Anyone opposed? Okay, it's unanimous. Welcome to the party, Bertra.
Thank you. Thank you.
I would also like to welcome Joe as a new member of the Community Services Board. Joe, would you like to say anything as, why you wanted to be on the CSB and what you're hoping for people with developmental disabilities here in Arlington?
I think one of the things that I like to say is, and I've always kind of quote this, I guess, is sorry, I was kind of put on the spot. Apologies, but no, I'm excited because I think it's as Bertra said, is very important work, and being a part of it is I'm just very happy to be a part of it and learn as I go, but also to share my experience, but also to listen to other people's experiences and learn from their experiences. There was a quote, a letter from a social worker Mr. Rogers always had, and it was something on the lines, I tried to look up the quote, it didn't come up, but it was something on the lines of, things like you can't truly, once you've heard someone's story, you can't not, learn to love them or something, and that's something that I really feel that is kind of what I'm, why I want to be a part of CSB and be a part of anything in Arlington. So, yep.
So welcome, Joe.
Thanks.
As you know, we've been doing these listen and learns, and LaVoy suggested that we do our next one on behavioral supports. It's something that we haven't spent a lot of time on. And a description of this is that the June Listen and Learn will be an opportunity to hear from our region's experts in the fields of applied behavioral analysis and behavioral intervention services. Parents and caregivers will learn about common and often challenging behaviors presented by individuals with developmental disabilities and helpful strategies. Developmental services staff will talk about services and resources that are available to families and caregivers. So LaVoyce's group will talk about therapeutic consultation, ABA, behavioral support under the waiver, the REACH Crisis Service, which is a regional mobile crisis and crisis therapeutic home, the Regional Project Office and behavioral support funds for individuals on the DD waiver waitlist. We'll have a presentation from the mental health side of the Bureau to talk about dual diagnoses, mental health issues that can blend into behavior health or at a minimum complicate them. So many folks with IDDD also present with a mental health problem. So we'll hear a little bit more about how to, what kinds of services are available on the behavioral health side and how to seek those services. Then we have Kristen Fergelli from from Core Analysis, who's going to focus on proactive behavioral strategies that incorporate values and compassion into goal development and intervention. Ellie Patterson from Patterson Behavioral Services is going to talk about the reactive behavioral strategies. So how to respond to those kind of quick incidences. Pamela Cool from Grafton has not given us exactly what she plans to speak about. And then I believe it's going to be Jenny Conroy from Social Graces will also present at that. LaVoice, do you want to say anything about that?
No, I think you covered it quite well, Sherry.
With support, LaVoice. I go, who were the other two? So thank you,
No, you
thank
got all
you,
of them.
LaVoice, for helping out with this. The other instance that's come to my attention has been that Arlington County has been offered 10 additional state rental assistance program slots. We've heard from Jennifer and LaVoice, all 10, the first 10 were available beginning in October. They're all but spoken for at this point. And Jeannie, are you still here? And can you add a little bit more on what you're seeing from DBHDS side of this, please?
There's not really too much more to add other than, we've made we have funding available this year. We basically approach programs that are at the highest utilization, basically 90% utilization and above, and Arlington meets that criteria because they've filled 9 out of their 10 slots with 1 pending referral that hopefully will be ready to go here in the next couple weeks. So at this point, if we don't expand SRAP in Arlington, we will have to start a wait list. And the benefit of SRAP is simply that it provides it's got a little more flexibility in some respects than some of the other resources available in Arlington, to the extent that an individual can have a live-in aid as an accommodation, and you'll be able to cover the rent assistance will cover both the housing for the individual and the live-in aid. So that's a benefit that some of the other programs wouldn't necessarily fully cover. So that's really it. So I think, we are flexible in terms of working with the county if there are issues that the county is facing regarding being able to fill those slots, how soon they can fill different slots. We certainly can work with them on that. And there's no requirement or deadline by which they would have to fill an extra 10 slots. We would simply want to be able to get that allocation into the county's hands so that it's available for the need as it arises.
And I want to note that these slots were allocated by the General Assembly in acknowledgement of the Department of Justice settlement to promote community integration. Paul Osgood gave a compelling picture of what being able to live independently in the community means. He is lucky he has a housing choice voucher, he says, but there are no housing choice vouchers available. Pete's living in an apartment, my son Pete's living in an apartment with a companion on the choice vouchers. Did I say there are no more choice vouchers available? I did speak to Donna Budway, who I think is somewhere in the corner here, and she's saying that the demand in it, can you tell us about the demand that you're seeing, Donna, please?
Yeah, I mean, it's interesting. We did just have someone move in from out of a group home here, and we are seeing more and more elderly parents that never really thought that this was going to be a potential setting for their adult children. But now we've been going into our 4 years and been able to demonstrate some pretty positive outcomes. Families, we've got families in their 80s. That are like, and they're young adults who are now not so young, in their 40s, 50s. are now talking to their aging parents and are very excited by the potential. So we do see people that we're kind of considering on our soft wait list. We send all those families to Jeannie and the state. They've just been amazing the way they have worked with our families. But do I personally think in the space I'm at, do I think we could fill 10 slots? Absolutely. I mean, just in the world that we are, we did. It was interesting to hear about hearing about people, the voice leaving the state. We have having leaving Arlington. We have families that are leaving other parts of the state to come up here. We've only had one that's already completely made the transition into Arlington. Actually, we've had two, but we have had other people move into OSG properties in the city of Alexandria and Fairfax, just because they really can't. There is nothing like this anywhere else in the state. And I know you guys don't want to hear that as hard as you're working. You don't want to hear that people are moving here, but I do think there is a movement in the state and that people recognize that we're actually having very positive outcomes. So thank you, Jeannie and the committee, everyone, for your hard work. But do I think there's room for more SREP? Absolutely. I mean, that's what the families are telling us. And honestly, people I never thought in my lifetime were ever going to think that their adult children could live outside of the family home or could live outside of a group home. So thank you for hearing my story. Thanks.
Jennifer, what's your perception here? Are you allowed to talk?
I was going to request to speak.
Thank you.
Yes, I would love to talk. So yes, we see the value in SREP. I know the value. I also know that we have all those 10 slots used, but we had someone come to us just last week, and we have other housing opportunities. I can't speak to them yet because they are so fresh. I need more information on it before I can speak to it, but it's not an SREP voucher, and it's not an Arlington housing grant. And it will provide the equal benefits, 30% of a person's income towards rental subsidy. So
SREP is 40. So this is.
Well, SREP is 30 to 40% a person pays with rent and utilities. This will be the same. So it's other resources the Housing Assistance Bureau has brought to our attention. There's also a meeting between DBHDS, Arlington County on Thursday, and our Housing Assistance Bureau. So we are, no one is going to go without, with living, how they don't want to live. We will come up with a solution.
Quick question. It sounds like there's an either SRAP or the other alternative. Why is it not and?
Especially because those are state dollars.
Well, when we have people who qualify for SRAP, we're going to go for the SRAP. When we have people who don't qualify, it opens other doors. Those other doors are also open to individuals who qualify for SRAP, but we're going to use the SRAP first.
Okay. So and the person that turned Jeannie down is not within developmental services. It's within the housing program. And Deborah and Jennifer just said that there's going to be a meeting on Thursday about that. So I'm wondering if we want. Go ahead, Jennifer.
I have one more thing I wanted to say, and what that is, your support coordinator for your families is the single contact for residential services. You can tell Jeannie or our stomping ground, but really it needs to come to your support coordinator. Your support coordinator comes to me and brings me the need, and that's how we get services and funding. And
Jeannie
at
cannot.
At a policy level, we can discuss it here.
Oh yeah, no, she's talking about the process.
In practice.
And Jeannie cannot start processing something unless it comes from the service coordinator.
Yeah.
So don't go directly to Jennifer or Jeannie to get this. Go directly.
So, and if I may, just to echo that as well, and also to go back to the slide in the presentation a little while ago about integrated housing. So our support coordinators are having conversations with individuals and families all the time around integrated housing, independent integrated housing. recognizing that it is something, we're fully aware that is part of the DOJ settlement and an emphasis on getting people, to consider integrated housing. We have fewer community living waiver slots, so the opportunity of housing more people in group homes that we may have had years ago, we're not going to be afforded those same opportunities in the future. And we also just know more about opportunities for people to just be able to live independently and not necessarily, in group home settings. Nothing against group homes. And we support that, independent housing as well. And we're not going to let someone go without integrated, independent housing if that's what they seek, whether we have SRAP or whether we don't have SRAP. In Arlington County, we actually have been so fortunate to have housing resources in locally funded PSH, locally funded Arlington housing grants. Well before we even had SRAP in Arlington County, we've had unprecedented numbers of people that have actually been able to move into independent housing in Arlington under Arlington housing grants, and are excited about the opportunities that come with the SRAP grants as well. And I do believe, if not this summer, soon in coming months, we're going to be opening up the wait list for the housing choice vouchers here in Arlington as well. We don't have the date yet for that, but that's going to be opening up sometime soon here in Arlington as well. And so there are a vast number of opportunities for people to explore. And we will continue to encourage, people moving and transitioning into independent housing.
Okay, Dorothy, I'm sorry, LaVoice, I'm going to have to cut you because the meeting is supposed to end at 6 o'clock, and I would like to see if there's a motion to support the offer of SRAP in Arlington by VBHDS from the committee.
I so move.
Okay, I have a first, is there a second?
A second.
Bertra, okay, we've discussed it. Those in favor, say aye. Aye. Opposed? I don't hear any opposition, and I plan to take our motion also to the CSD tomorrow. I'm sorry, LaVoice, to cut you off, but I know we have to meet within our period. For those of you who are vendors, if you can either put something in the chat and I will add it to a notice after this meeting, and LaVoice, I'm sure you can get me the PowerPoint to send out through the DD email list. And Community Living Alternatives has just opened a new group home in my neighborhood, and I hear that they have openings. So those of you who are looking for group homes, that's up to your service coordinator. Okay, at that, is there any other thing? Okay, at that, I adjourn the meeting, our motion to adjourn. First, second, okay, goodbye.
Sherry, I printed this out for you. This is.
Yeah, I was going to say, I'm going to pull you.
Wanted to
Oh, no.
ask you
Yes.
a little bit about.
Yes.
Now, it's going to be more medically involved.
Yeah, I brought.
Yeah.